Hi everyone! It's me again, Arisa De Silva, and I'm going to talk about pulse rate. Pulse rate is the measurement of the heart rate, or the number of times the heartbeat per minute. Pulse rate may fluctuate and increase with your activity or exercise you make, or if you have injury or illness, also with your emotions, like if you are stressed. There are several pulse points in our body. Temporal pulse, felt in the temple area of the head or above cheekbone. Taking this pulse can signal a malformation in the blood vessels. Carotid pulse, felt in the neck, taken to determine pulselessness in an unconscious victim and to decide whether or not CPR should be initiated. Brachial pulse, felt in the elbow, taking for measuring blood pressure. Femoral pulse, felt in the groin between leg and stomach, taken to detect coarctation of the aorta and left-sided heart malformation. Popliteal pulse, felt behind the knee, checking this to evaluate how much blood is flowing to the lower leg. Apical pulse, found in the left center of the chest or below nipple. For infant or young children, located at the port ICS or the intercostal space of the mid-clavicular line. And for adult, located at the PIP ICS of mid-clavicular line. Dorsalis pedis pulse, felt in the foot. It can be palpated lateral to the EHC or the extensor hallucis longus tendon. Posterior tibial pulse, felt inside the ankle. Take if the client has peripheral vascular disease. Radial pulse, felt in the wrist, taken to determine heart rate by finding radial artery. I'm going to demonstrate the process of radial pulse. Before you start any procedure, make sure to wash your hands with soap and water. This time, I'm going to use the alcohol-based sanitation. Next is, you will need the following equipment. A record book, ball pens, a tray to set all the materials, and of course, the wristwatch or a timer. First, assist your patient to sit down for his comfortable position. Make sure that he is at rest for several minutes before taking his pulse for his accurate reading. Place client's forearm straight alongside body and place your pointer finger and middle finger in his wrist. Find in which part you can feel the beat and then press it firmly but gently. Don't use the thumb to check the pulse because it can make harder to count accurately. Once you feel the pulse, using your watch, count how many beats you feel in 1 minute. And that count is the heart rate or the pulse rate per minute. And then record the reading together his name, date, and time you taking the pulse rate. The pulse rate for the infant or young children depends when he or she is awake, rating to 120 to 160 BPM, or when asleep, 90 to 110 beats per minute, and when crying, it's ranging to 180 BPM. And for the adult, regular rate is about 60 to 100 BPM. If you've noticed irregular pulse rate, like too fast or too slow, it is called arrhythmia, and a regular administer is required for that. So that's it, guys. I hope you've learned so much taking pulse rate through radial method. Thank you for watching and have a good day!